Welcome, everybody. We are here on our second series, our second episode for the Michigan HIV/AIDS Council highlight. Today, we will be highlighting someone specifically special that works in the community that has been doing phenomenal work that we would love to have some more conversations around and just get a little bit more details about the work they perform and some of the clients that they encounter out in the community. So I'm going to introduce David Hind, and then David can tell you a little bit about who he is. Preferred pronouns, David?
He and him.
He, him. Perfect, perfect. And once again, my name is Ari Hampton. I am your special interview liaison for the Michigan HIV/AIDS Council. And thank you, everybody, for just joining us today. And we hope that this is a wonderful conversation to take away some wonderful aspects and techniques that we can utilize out in the community. So, David, I'm going to kick it over to you and let you introduce yourself a little bit.
Hey, Ari, thanks for having me on this episode. So my name is David Hind. I am a program manager with the Alzheimer's Association. Real quick, the association is a nationwide nonprofit organization focused solely on providing education and support services for folks living with dementia and their unpaid caregivers. My role, I'm so happy to say, I focus specifically on those services as they relate to men and women living with HIV, as well as folks in the LGBTQ plus community, because we know these are two communities where there's a greater need and much less access.
That's amazing work. Amazing work. We appreciate you so much for being here with us and sharing some of your wise words and wisdom of all of the work that you're completing out in the world today. So that kind of like is a great segue into my first question. How long have you been doing this work?
That's a good question, Ari. I'm going to show my age. I've been working in HIV and AIDS services as well as LGBTQ plus advocacy for more than 20 years. And I'm really happy to say the first big chunk of that was a whole different world. And I'm just doing it now in Michigan for a couple of years.
Oh, that's beautiful. That's beautiful. Well, thank you so much. I know I am a person that has been living with HIV for about 16 years now. So I've been a young person living with it. And now I'm moving into more of that category of aging with HIV and what long term looks like for us, especially when it comes to our care, the things that we go through in life. It's a great aspect of a conversation to have, especially because I think people in today's world think that the medicine is there and so everything is fine. And so they don't understand what truly aging with HIV looks like. So I thoroughly appreciate you being here for this conversation today. So can we talk a little bit about your work, specifically around the communities that you service? Can you talk a little bit more about that?
Sure. As I said, prior to moving to Michigan, my work was kind of a very broad general population. I provided a variety of services to men and women living with HIV in New York City. And we did everything from our congregate meals programs to our food pantry. And one of the things I'm most proud of was developing our workforce development programs, because folks are living longer, folks are looking at careers, folks are looking at, the long-term retirement plans. So that was really cool. That was great stuff. Since I've moved to Michigan, as I said, I'm grateful for the opportunity to be able to look at something as general as dementia and the impact it has on our community specifically. So working in Michigan is just very different. We have communities, we have folks, we have a great deal of need, but I don't know that we have a really comprehensively coordinated approach to this. There are folks providing great services in different parts of the state, but I don't know that we have the connected service. So I think that's one of the challenges I see that I think we're making progress in, is pulling all this together where folks can actually be directed in a less complicated way.
Yeah. I totally understand where you're coming from in that aspect. I think a lot of times we do great work within specific counties, especially here in the urban populations and metropolitan cities. But we often forget that Michigan is such a wide and long state. And so there are so many people living with HIV, who are aging, who are battling these issues of dementia or other illnesses or terminal cases that are just contributing to our health as we age and everything else, that we need these services and to be linked into the proper care that we need. So that's a great segue. I love a segue, as I always do. But that leads me, when we're talking about community connections, specifically here on MHAC, what made you kind of want to join MHAC?
Good question. So again, this is all new for me. I'm going to say this more than a few times, right? I'm still learning so much about the world of Michigan. So I started working with the association, doing general services, working with 10 or 12 different counties on the general program services. The opportunity came up within my chapter to focus specifically on HIV services. And I was going to say, I jumped at it. The management in the office, knowing my history, was like, we've got an opportunity. It kind of smells like you. What do you think? So yeah, I was excited to hear about that. And the minute I started doing the work, I just started exploring what the community looked like outside of my little pocket of the world here. And you're right, different services, different degrees of community and access and availability, county by county. I joined SEMHAC immediately, or I asked to join SEMHAC immediately. I was grateful when I was accepted. And then learned about MHAC and learned that there's this coordinated effort on a statewide level to connect everybody. I'm like, well, damn, I have to be there. And again, grateful. I applied. I was accepted. It's only been, geez, I don't know if it's been a year or 2 years now. Time flies. It's been such a great experience working with the diverse, committed team in MHAC. It's really awesome.
Oh yeah, oh yeah, and I will say I've been on Impact since 2018, so it's been a little bit long of a time. I just officially took a step back as a full-time member, but still want to stay around in a certain capacity because of folks like you that are doing phenomenal work and really inspire me to continue on my fight, to add my voice to see how my services or my knowledge base can help strengthen our services across our great state of Michigan. So first of all, I appreciate you. I can't say that more than enough. For me, meeting folks that have the capacity of empathy and compassion for healthcare services and making sure that we help the people that truly need our help, has always been centered in my mind as somebody that needed that space many years ago, 16 years ago. And even just navigating living with HIV, there were so many silos, I guess we could say, that I didn't know how to navigate myself. And so being that guinea pig, learning from folks like you, building up my repertoire has helped me do the same in return for people that don't work in this field, the clients that we service every day. I believe in full transparency of services, making sure that people are not blindsided by what they need to do to just access human rights services, basically. So once again, I'll say it again on here. I appreciate you. Thank you, thank you, thank you. So now I always like to kind of start off with that piece just to know like why you do what you do and some of the folks that you serve. But we understand in this current political climate, things are kind of wonky a little bit. And so there's a lot of questions that people have. As a healthcare provider yourself, as somebody that works in this field, what are some of the barriers that you are seeing that you're coming across?
It's interesting. I come from an interesting perspective, I think, right? So the foundation of my work with the association is Alzheimer's disease and dementia. Pardon me. And one of the beautiful things about that is that doesn't have a political side. So when I go talk, we do advocacy in Lansing, and I go and I talk to legislators, I don't have to worry about whether I'm talking to a Republican or a Democrat. because dementia is one of those diseases that has no side. Everybody gets it, right? So I actually manipulate that a little bit when I do my work with HIV, because I think that helps me get the point across that HIV is you and me, right? HIV isn't them. Um, and there's a way that I can tie that in when I talk to folks about the foundation of the work and why I'm addressing certain communities. All that said, um, greater greater cultural barriers here than I'm accustomed to back in New York City. Um, you'd have a hard time finding a heterosexual HIV negative person in my world back in New York City. We were all community. Clearly that's a difference here. And the challenge I think we have, again, is opening the door to it not being an isolated world, it being the world, a piece of the world. Um, so yeah, I try to take the lessons I've learned over the years and, if you will, kind of change the translation to make it more appropriate here. I'm making some mistakes along the way, trust me. But for the most part, I'm happy to say that my approach and presentation has been well received, and I've actually opened doors in areas where nobody's talked about HIV before. So it's been an exciting, slightly bumpy road.
Oh yeah, oh yeah. I can tell you, I have been doing work in public health in Michigan since 2012, and when I say like, that's just the state of the name of the game. When we work with humans, when we work with just general populations, our job is not to be liked by everybody or understand every single thing. It is to have the compassion and the empathy to learn and grow together with our clients. And I think you demonstrate that and eloquently said that so well. And that's what makes people stand out in communities, not just in work. Because I think a lot of times we have a lot of folks that are in this field that do things just for the notoriety or the awards. The true success comes from when you hear it from your clients, when you're actually able to bridge those gaps in services and make a difference and to change the nature of the game. So thank you again. You'll probably hear me say it over and over again today. But that also brings me to lead, like I know we talked a little bit about barriers. I always think about solutions, and I want to save that for my next question, is just what could be done to alleviate some of those barriers in your mind or your opinion. But I'm quite curious, because of the nature of your work, what are some common things that you try to tell the communities or just clients in general to kind of be cognitively aware, like signs and symptoms of onset dementia or Alzheimer's that people may be experiencing, that a lot of times, especially like communities of color, LGBT populations, we don't necessarily think about those things all the time. So I kind of want to get it from your words of what should we be identifying?
Thanks for asking that. It's really interesting when I talk with targeted communities, right? As you said, there's so many different communities that we have around us, whether it be communities of color, LGBTQ plus community, faith-based communities. The ironic thing is, all of these different communities have more in common than they have differences. And when I talk with folks, I think you and I have talked before. I think we did 22 prides in Michigan last year, right? We were everywhere. We were all over the state. And that was awesome. And every event we did, when I talked with someone and said, people in the LGBTQ plus community have a greater risk of developing cognitive impairment and are much more likely to be unpaid caregivers than the general population, I'm always met with doubt. And maybe I just don't look smart. I don't know what it is, but people's response is, that can't be true. No way. So when I talk with folks about the things that increase our risk in a community, and they often don't believe me, I explain things like, so many marginalized communities experience similar cultural lifestyle impacts. So some of the factors that can increase your risk are things like increased anxiety, increased depression, isolation. In addition, there are the social habits. There are increase in alcohol and substance use, increase in tobacco use. These are all things that can increase an individual's risk for cognitive impairment and dementia as they get older. When you look at our community, the LGBTQ plus community, much higher rates in that community for everything I just mentioned. When you look at folks in communities of color, much higher rates of those issues in those communities. So you start to put all these factors together and it makes sense. So what I tell folks, first of all, hear it, understand it, accept it, and take a little bit of stock of yourself. Like, what's going on in your life? Are you feeling increased anxiety and depression? Are you feeling isolated? Do you choose to do the things that maybe I shouldn't drink as much as I do. Maybe I should cut down on my smoking. If you can do that self-assessment and come up with any sense of, yeah, maybe I could improve things a little bit. No silver bullets, no magic cure, right? We all do our own self-assessment and we make whatever changes we think we can to the degree that we're comfortable. And number one, do that with someone, do that with community, right? One of the most important things when it comes to doing these kind of self-assessments and maybe taking stock is having somebody you trust do that with you, whether it be one person or a whole group of people like MHAC. Talk this stuff out. And nobody has to change their entire life, but small changes make a big difference. The saying right now, if it's good for your heart, it's good for your brain. So, if you work from home and you don't go anywhere, go somewhere, right? Take a walk around the block, do something. You don't have to run a marathon. Take a walk around the block every day. Make a phone call to somebody you haven't spoken to in a long time and enjoy talking to. Get your body, get your brain engaged, do it with people you like and trust. And that's a good start to keeping your brain active and healthy.
That's amazing. I think those are some beautiful techniques, especially with how stress levels are nowadays with the climate. And a lot of people are worried, especially communities that are living with HIV. As I like to say, living fabulously with HIV. But, there are real stressors and real worries out in the community. And I think this is something that we all can do to assess where we are emotionally, mentally, physically. To make sure that we're addressing certain things that are coming up for ourselves and not just saying, oh, it's not a big deal. I'm not going to go to a doctor to figure out what's happening. If you notice things are not as they seem or things that are slightly different from what you're usually normal to for yourself, I think all of us would agree to just make sure you get that secondary opinion from a physician. Make sure you go do the follow-ups. Make sure you're seeing your primary care doctor once a year at least. If you are living with HIV, make sure you have these conversations with your infectious disease doctor, making sure that they're privy to the knowledge base of what's going on with you. Even if it may not be physically, there are things that happen to us internally that we're not seeing on a day-to-day basis that we need to address as well. Mm-hmm. So I appreciate that. So now I like I said, I wanted to save the solutions question till after that one, because I really felt like that was a piece of advice that a lot of us really truly need nowadays. So as far as barriers, we talked a little bit about just the expanse of services outside of just metropolitan cities and making sure that people can get the access of services that they need across the state of Michigan, and a few other things. So just kind of tying that back into this question is how can, and from your own opinion, how can some of that be alleviated as far as barriers go?
So I want to add to what we just talked about, just one more thing. I know it's often challenging for everybody to get your doctor's time, to get, the appointment you need, to get the amount of time you need in an office. I think it's really important for everybody to remember that if you've got support services around that, that's as critical as your doctor, right? So your case managers, your navigators, anybody else that you're talking to, that's a good person to say if you think, as you said, there's a change in your physical health, there's a change in your cognitive health. If you think something's going on and you're not due to see your doctor for 6 months and you don't think it's important, talk to the other folks doing your support services with you. And I guarantee they'll follow through with you. And if they think it rises to the level, they'll take it to the next level. So that's important, I think, too. So often we wait for our doctors to give us time that we kind of neglect the things we need to talk about. So yeah, I just wanted to throw that in there. Solutions, man, I got to tell you, one of my biggest challenges here is working even within the established care environments is with our particular point, our issue of cognitive health, there are so many competing priorities when you talk about HIV care, right? There's your diabetes, heart health, respiratory health, your smoking cessation. There are all these really important things going on just based on your physical health. Then there are the social aspects as far as, financial abilities, food insecurity, housing challenges. There are so many competing priorities. When we talk about cognitive health, I feel like it gets a mild response as opposed to that's a significant thing that we're not talking about. So what we're finding is with both medical care providers and the support service providers, there's not a lot of conversation about a person's ability to be cognitively healthy. We just recently started a summit. It's over a year now, actually, working with providers to try to figure out. I mean, and everybody in the room knows, like, yes, I know I've got clients whose memories aren't the same and who, have trouble processing thought patterns but we're not doing anything about it because everybody's understaffed, everybody's overworked, resources are limited. So again, you've got to go to that competing priorities list and address the heart health because you want to make sure you want to address the weight management. So I think that's one of our barriers that I think we can overcome if we talk more about it in community. And I don't mean just folks living with HIV talking to their providers. I mean those of us doing the work, talking to each other and asking each other, are you talking to your folks? Are you asking your folks? What would you do if you experience someone come in with some clear cognitive challenges? What are you going to do for that person? We've spoken to a few support service providers who have simply said, I told that client, when you talk to your doctor in October, make sure you mention it, as opposed to doing anything kind of substantial. Like, here's what you're going to do. We're going to call your doctor's office and we're going to get a test. I think there are simple solutions, but like so many other things, it requires the village to make that happen.
Yeah, that's so true. That's so true. I love what you brought up as far as making sure that we're assessing clients appropriately, in all facets, not just waiting for them to speak with a physician, but to know our clients as a care team and to, if we notice something, to start assessing a little bit more. It brings a question in my mind because I know typically in our most care units, we're doing cage assessment forms. And for anybody that's watching this that doesn't understand what a cage assessment form is, in a nutshell, basically it addresses social, emotional, and behavioral needs. Also addresses some social service needs that may be addressed at that moment. So it could be, are you currently abusing drugs or alcohol? Are you emotionally feeling adept of not harming yourself or anybody else? Are you in a stable relationship? Are you working? Do you have a stable home? We ask all of these questions, but as David is speaking, we don't address what's happening mentally. and the cognitive aspects, not just the behavioral aspects. And so I wonder if that's something that maybe we can address on MHAC's level and talk with the state health department to see if we can create a helpful assessment tool for physicians to utilize when they're speaking with their clients. So that's why we love conversations like this, because we get to brainstorm a little bit and see how we can strengthen not just what I do on my side, but also what everyone else is doing as well, so we can have the best case scenario for clients when it comes to services. I love that. Love that. So now I kind of want to know a little bit more about why you do what you do, David. Now I'm in that section where I just want to know a little bit about your passion and what kind of drives you for the work that you do.
Some of it's going to sound so cliche. It's important to me. This is a part of my very being. When I was very young, I started doing things like volunteering in communities where there was a need that I kind of understood and saw that wasn't really being addressed. And this comes back from, my mom raised us. We were born and raised poor, right? But I was a dumb kid. I thought we were the best people in town because we volunteered at, the food pantry. And I was like, we're such good people. We volunteer. Well, you know what? The truth was we were clients of the food pantry. And my mom insisted if you're going to take in community, you're going to give in community. So learn that at a very young age. And it turned out I was volunteering for an organization for the early part of my career. I worked for city and state government. It was really good work. It was important work. But it was city and state government. I made no money whatsoever. So I left that and decided to work in the private industry and make real money, which I did for a little while. But there was no passion for me in any of it. And I was feeling more and more connected to my volunteer work. And I just kind of walked away from the for-profit world. Again, there was no soul in the work. There was no heart in the work. And I went back. I chose 3 organizations that I was going to get a job at, or I was going to die in the street. And I was lucky, and I got a job at Gay Men's Health Crisis, and I got to get really deeply connected and involved with the community. And that the kind of work we do, Ari. Once you're doing that work, it doesn't go away. And then when I got to Michigan, I took a little time off, got the job with the association, and I was fulfilled. Dementia and Alzheimer's is near and dear to me. My mom just recently passed from dementia was a cause of death for her. And I'm here in Michigan because my mother-in-law is living with dementia, among other things. So near and dear to me. So it was, not to say that I didn't have the passion. The passion was different for dementia. But when, as I said earlier, when this gig came up, I thought, I'm here. There's a whole other reason why I'm in Michigan now. So yeah, it's deeply, deeply rooted in me.
Thank you for that. First, my condolences to you,
Thank you.
for your mom and what you're currently dealing with your other loved one as well. I'm currently living with going through a similar scenario with someone that I deeply care about, that is battling onset early dementia as well. So it's a very interesting thing that I think touches every single person that we just don't talk about it that much. It's a silent battle for the folks that are not living with the condition, and an even bigger molehill and battle for the person that is. And so much respect to the work that you do, and thank you again for showing up and having that empathy and that compassion. You are rich as hell in your in your spirit and your heart. As my mom would always say, we may not be the most richest people, but our hearts and our spirits are full, and we are the richest people when we show up and serve our communities and the people that need us the most. So I appreciate that so much. And so I kind of want to just give you the space. We're coming to the end of this interview. I want to thank you again for being vulnerable and open to this discussion and sharing all of your knowledge, your resources, and your personal stories as well. I appreciate it so much, and I hope everyone that's watching does as well. Um, One, before I get to my last phase, which is just kind of letting you have this floor to talk about where they can access your services, how they can reach out to you. Um, I did have a question. As so many people, we have a lot more people that are aging with HIV now, especially people that are in their mid 30s, that are going into their later adult years that are have been living with the virus for years on end, past 15 years. And so I think when we hear about Alzheimer's and dementia, we automatically assume that that only happens to people that are in later in life. When you reach about late 60s to up into the 90s, not realizing that these things can typically happen to people that have been living with the virus for a very long time as well. Can you speak a little bit about that for folks?
Sure. Thanks for asking about that. And that's a really important distinction. So we know that folks living with HIV long term, right? Not necessarily older. Um, Aging happens when you're 7. You're aging from 7 to 8, right? So folks living long term are seeing an increase in cognitive impairment, cognitive decline. Um, and at the conference last year, I met folks from the Lifetime Survivors group, and it wasn't an expression I was familiar with. And these are folks who are born positive and live their entire lives with HIV, and we're seeing they're experiencing very young changes in cognitive health because it's from birth. We're looking at folks, as you said, somebody who's 40 years old has been positive for 20 years. That's a long time to be living with the virus. It's a long time for the medication. It's a long time for your body and your brain to absorb and respond to that. So yeah, we are seeing increases. One of the things I think is very challenging. It's estimated that anywhere from 35 to 50% of people living with HIV long term are experiencing some degree of cognitive decline and impairment. Our diagnosis rate in Michigan is really low. So we know folks are experiencing this. I mean, more than half the community is over the age of 50. We know that. And we're just not seeing the diagnosis, which means we're not seeing the conversations. And I have to say, you mentioned, MHAC is great. MDHHS is fantastic. They make the work we're doing possible. We're one of the few chapters in the country doing HIV and dementia work. One of the few in the country, and that's all due to our State Department of Health and Human Services. And they fully support whatever wacky stuff I come up with or my office comes up with. They're like, try it, go for it, do it. Don't break any laws, just do what you got to do. Um, I think we need to coordinate more. I think we need to pull that. I talk about HIV and aging with every opportunity I have. I could be sharing a recipe with somebody, but if the right word comes out of that conversation, this is part of the conversation. I do that with all the work that we do, and I think it's critical that MDHHS keep doing that with unexpected partners. It doesn't have to be an HIV and AIDS service provider. It can be it could be a church in a community looking for government support. It can happen. It should happen everywhere. Sorry, I didn't mean to go off like that.
Oh, you are all good. No, I love that because I think, as you stated, a lot of times the screenings are not happening when it comes to clients, and so people are, and I think a lot of times that does fall a little bit back on the physicians, where it's unintentional bias. It's the complexities of thinking, well, this person that's sitting in front of me may have been living with the virus for 20 years, but they're 40 years old. So dementia and Alzheimer's is not going, or cognitive behavioral issues may not be a part of this person's journey, when technically that could be a primary problem for this individual that they're not assessing and diagnosing at that time. So I love how you just eloquently said that. And I think there are some things that not only MDHHS can just help strengthen a little bit more when it comes to making sure that these services and assessment tools can be utilized throughout, like you said, not just physicians, but throughout all community aspects. And I've worked with, I did a project back in the day called the Stigma Index Project, which was funded by the Vatican Church, looking at stigma and discrimination for people living with HIV. I know, funny, funny enough as it is, but faith-based communities have been pivotal in showing up for the work that we do. It's because of those community resources that people can access services and find out certain information that they typically can't find. Google doesn't always update their information. A lot of times other health departments, MDHHS has been very pivotal in making sure that they're updating their resource pages. But a lot of times most agencies in other states are not doing that aspect. And so people are not finding the services or accessing the referrals that are needed for the community services that we have available. So I appreciate what you're doing. And I think there's still much more that we can strengthen and much more that we can expand when it comes to your work, and tying that in totally with how we do our education for providers and other service care providers as well. Not just PCPs, primary care physicians, but we need to be talking to case managers. We need to be talking to pharmacy reps. We need to be talking to nurses, people that are seeing clients a little bit more frequently than just their primary care for doctors. So thank you again. Told you you're going to hear it all day long. Thank you, thank you, thank you. Thank you for all that you do. So now I just want to open the floor up to give you space to kind of talk and share whatever information you feel comfortable, as this will be going up on YouTube. So agency, website, anything of that nature. But how can people find you in the work that you do?
So, as I said when we first started, we are a nationwide nonprofit. We are the Alzheimer's Association. We have chapters in every state across the country. And I'll give you Michigan as the example. We have one main office in Michigan, but then we have scatter site offices throughout the state. And where we don't have offices, staff like myself work from home, so we can be directly connected to our communities. So to reach the Alzheimer's Association, our general 24/7 helpline can be reached at 800-272-3900. Now that is a nationwide switchboard staffed by master's degree social workers. Their work is to give you information, direction, guidance, whatever you need as it relates to Alzheimer's disease. But they're also equipped for crisis intervention. So anybody who's experienced somebody with hallucinations or delusions brought on by dementia at 2 o'clock in the morning, you don't want to call 911 because your grandmother is hallucinating about, cowboys and Indians raiding the property. You call the association, and our helpline counselors will stay with you until you resolve your issue. Our website is a really difficult website. It is alz.org, really hard one to remember. It's a very complex website because we are such a wide-ranging organization. Simple stuff, just plug in simple words. What else do I want to say? And I think what I said before, I can't stress it anymore. It's really important that we all work together, and not assume what other people know or don't know. It's really important that we remember how important what we're doing is to everybody, even if we're not reaching them yet. There are so many people out there who could benefit from what we're doing who don't know about us. And so many people who know about us don't have don't have the ability, whether it be individually or community or family, they just don't have the ability to make that next step, whether it's a phone call or, an introduction. We have to remember all the time, no matter how good we're doing our jobs, there are people who still need our help who we're not reaching. And I'm telling you, I'm learning that more and more every day here in Michigan. When I talk to somebody in a county and says to me, we don't have gay people in our county. We don't have anybody living with HIV in this part of Michigan. And I know for a fact folks in that county are accessing service in the next county where it's safe. So our folks are everywhere. We just always have to be on our toes to figure out how to find them and how to help them.
You're so right about that. We are everywhere.
Mm-hmm.
And
Yes,
not in an
sir.
ominous way, but we are human beings that are just trying to thrive, not just survive. And we are not second class citizens. We are not people that should be talked about, downed, as you see above my shoulder, fight stigma. And that goes in every sense of the form and fashion of the way, in every community, because we are all human beings that should be treated as whole human, istic, just beautiful individuals, as I like to say. But thank you, David. I appreciate everything today. I will be leaving your information for the Alzheimer's Association down below in the YouTube link. You can also access services by visiting the website. It is a very easy website for you to find. So, and if you have any additional questions, feel free to reach out to the Michigan HIV/AIDS Council. Sorry, I don't know what tripped me up there, but please reach out to us and we can always facilitate a connection with David if you need to, if you want to learn about volunteering or just get some more information about the services here in Michigan. So thank you again, David. I appreciate you, and we'll sign off at this point.
Thanks, Ari. I appreciate you too. Thank you.